Hi, my name is David Snipelisky, one of the co-editors of the Fits on the Go blog. I am here with Dr. Pamela Douglas, who is presenting her late-breaking clinical trial. Thank you so much for joining us today. Dr. Douglas, do you mind describing some of the background in regard to the study that you are presenting?
So the study that I'm presenting is called PROMISE, and it's a trial of 10,000 patients with chest pain to figure out the best diagnostic strategy for these patients. And the background is that even in the United States alone, there's over 4 million patients with stable chest pain who require stress testing every year. But we have never done a study of those patients. So there was a lot of absence of information, if you will, about who those patients are, what the results of testing are, and what the clinical outcomes actually in these sorts of patients. So in this background, we said we could do better because we have too many patients going to the cath lab that don't have obstructive disease. And so we said, well, maybe CT could do better than traditional stress testing since it's more accurate for the diagnosis of obstructive coronary artery disease as well as for excluding it. So that's the background for the study.
That is very interesting. Could you tell us a bit about what the study entails?
So the study was a very comparative effectiveness pragmatic trial, and we randomized patients to either CT angiography or to a stress test of the doctor's choice. The test was read locally at the hospital and care was determined locally, and we followed the patients for a median of over 2 years, but up to 4 years.
That's very interesting as well. What type of clinical implications would you foresee in the future?
Well, the main findings of the study were first that there was a very high risk factor burden in these patients. So there was an over 50% pretest probability of coronary artery disease. They had an average of 2.5 risk factors, and in fact, less than 3% had no risk factors. And they were middle-aged and older and symptomatic. So that's the first finding, is that this was very appropriate to be testing these patients. Next, we found that the event rate was extremely low, just 3% over 2 years, which is great news for patients and physicians. Our primary endpoint of death, MI, unstable angina, and major complications from cardiovascular procedure had similar outcomes in the two arms. However, CT was superior in two secondary endpoints, not the major events, but two that I think are very important to patients. There were fewer patients that went to cardiac catheterization, invasive catheterization, without obstructive disease, so less unnecessary catheterizations, and radiation was lower than in nuclear stress testing. So while the big events are obviously driving the primary endpoint of the trial, other considerations that are important to patients and their physicians both favored CTA.
Quite impressive, and I'm looking forward to seeing more in the future about it, and I'm sure it will definitely help our patients. Thank you very much for joining us today. Again, David Snipelisky with Dr. Douglas, reporting on her late-breaking clinical trial. To see more videos on our site, please join us at www.youtube.com/fitsonthego.